Good morning, everyone. This is Dr. Susan Marra with Dr. Marra's Medical Minutes. And today we're going to talk about methylene blue. Methylene blue is just an amazing compound. It is a dye. It is not an antibiotic, but it is very effective at treating Lyme and malaria and Bartonella. And you do have to get it from a compounding pharmacy. So it's not readily available at your regular pharmacy. And interestingly enough, it readily crosses the blood-brain barrier. It readily is taken up by tissues. It's an electron donor. So it functions sort of like an antioxidant. And it is unbelievably useful for treating Bartonella in my practice. It is the bioavailability of oral is the same as IV, and that's amazing because that's not typically the case with typical antibiotics. So methylene blue orally works really, really well. And it was identified, I believe, in Britain in 1876. And it's got many, many uses. Like I said, it's a dye. It's got many uses. And it turns your urine blue. It also turns neurons blue. So it's very good for staining tissue. And when you take methylene blue, your urine will be bright blue. And what you do is when you urinate in the toilet, you just make a compound of half isopropyl alcohol, half water, and you spray it in there and just swish it around, and you won't have staining of your toilet. The thing that I like about methylene blue is it really, you can start low and go slow, and you can increase the dose and not cause people to herx. I mean, some people do herx with it, but it's not the same kind of a herx as an antibiotic. It's softer. And so that's why I like to use it so much. It's really, really effective. And it's not that expensive either. Insurance, of course, doesn't pay for it, but it's not really that expensive. It does have a few interactions. It interacts with certain foods like wine, cheese, meats, and dry foods. And it does interact with some herbs. St. John wort, 5-HTP, melatonin, and it can cause something called serotonin syndrome, so we have to be careful with that. But generally speaking, methylene blue is very safe, and I would highly recommend that you talk to your doctor about it, or you give my office a call, 206-299-2676. We are very experienced with treating Bartonella, mostly because I have it, and I've had it for 24 years, and 85% of my practice has Bartonella. So I hope you have a wonderful day. I hope this information helps you. Take care.